Thanks for staying with us here on The Real Story. We're just a few weeks away from the new legislative session where in the new year, state lawmakers will be tasked with passing another two-year budget. But before we get there, Connecticut groups are laying out their challenges, new data and needs, including our state healthcare networks. Joining me now to break down what's packed into the Connecticut Hospital Association's new report this year, Paul Kidwell, Senior VP of Policy for the Connecticut Hospital Association. Paul, thanks so much for being here.
Nice to be here. Thanks for having me.
So I want to start off with the new report. Once again, the association, as well as all your partners and networks, put together this annual report. Last year's report was pretty bleak when we talked about it. Hospitals operating in the red. This year isn't looking a whole lot better. What was the overall feeling collecting the data and going through those experiences right now? Yeah,
so we try to do this annually because it gives a sense for policymakers and lawmakers as we enter the session. What are hospitals and health systems in our state facing? What does it look like? And I think the general impression across the state are things are getting marginally better, which is good. Improvement is always good. But we still face a lot of the same concerns that we were facing a year ago, which is, and our report shows that on a whole, the state's hospitals are still operating on a negative margin, 0.5%. It's better than negative 1%, which was last year. But a negative margin, it cannot be sustained for any amount of time. And while we do see improvement, we really do need to improve more over the next couple of years.
And I think it can sometimes be really hard when we're having these conversations, when CHA goes to the legislature to ask for help, for patients to accept that. I know we've discussed it boils down to hospitals are businesses, as you said, operating in the red for the past couple years. Right now, we have really difficult conversations and reactions coming off of the killing of the United Healthcare CEO. I think there's just a really big focus. It's come into the sphere more in the past couple weeks. People expressing their frustration with insurance as a whole, public and private. But, what do you say to people who think, how can hospitals possibly need more money? Why should we care? Why should they get focus and money and time from the state?
No, it's and let me first say, the tragic events of the last 2 weeks are unfathomable, and certainly understand people's frustrations with the system. But that violence is just so unacceptable. Why should people care about the health of our hospitals in the state? One, because they're always there when we need them, and not just in times of emergency, but in trying to make sure people stay healthy, manage their chronic condition so that they don't end up in the hospital. They are a pillar of their communities, and they invest in community health and in community organizations. So it's more than just what's happening in the four walls of the hospital. And people are right to be certainly skeptical. We spend a lot of money in America on healthcare, and especially in hospital care. And we need to do all we can to make sure that we're containing costs as much as we possibly can. So we're moving really expensive care from the inpatient into an more efficient outpatient setting. We're investing in community health to make sure people stay out of the hospital. But as you noted, revenue is important to make sure that the lights stay on, that we're always there. And we're facing really significant reimbursement challenges, especially from Medicaid, which the state controls, and Medicare, which the federal government controls.
Yeah, and speaking of that Medicaid piece, paying just cents on the dollar for services, you all have argued with that coverage formula and saying there's no way for healthcare networks to catch up then. Last year, you asked the legislature to reevaluate the Medicaid program, but this year, this report, it's really a banner issue for you all. Walk me through, where we go from here when we get when the legislature reconvenes in a couple of weeks.
It's going to be a tough conversation. So if just the numbers, currently today, the state pays 62 cents on the dollar for every dollar of care provided. And if you think about a family budget, you can't really make it if you're only bringing in 62 cents of the dollar that it's costing you to survive. And so, and that equates to a $1.43 billion shortfall every year. So we have to make up those dollars in some other way. So we hope to have real productive conversations with the legislature. We understand the fiscal pressures, we understand the fiscal guardrails, we understand the need to be responsible stewards of the taxpayers' dollars. We think investments in Medicaid are good, fiscally responsible investments. And as hospitals, we think we have an opportunity to work with our legislature, work with the state to really address those shortfalls while also being fiscally responsible. So really difficult conversations, complex, but we're excited to start having them.
And we know that's obviously a must cover within the state budget. As we mentioned, lawmakers going back to craft that next 2-year package. As you said, though, complicated, tough conversations. And even though Medicaid isn't paying hospitals full service costs, it's still consistently coming in over budget as is. We did get to talk with Comptroller Scanlon, and I want to play his response when we asked him about this as well, so you can hear.
Great.
There is a universal desire among policymakers and providers to raise Medicaid rates in our state. It's something we haven't done in a long time. It's something we should do. And we've been talking about doing that as we work towards this next session. But there's been a big change too, which is that we have a new federal administration that has publicly said they may want to change how Medicaid is paid for. And so we may not be able to have a conversation about raising rates because we may have to be putting more money as a state towards Medicaid. I think it's far too early for us to know exactly what's happening. The desire is there. We want to make sure that providers get paid more to pay and see Medicaid patients, but we're heading into a bit of an uncertain territory.
And the Comptroller has said this before, that obviously there is that desire to have the conversation and they want to bring everybody to the table and work with the state legislature, but it is kind of an uncertain time right now, and that's going to play out once the legislature gets back into session. How do you think that's going to play out, and do you have any message for those state lawmakers who are kind of looking at this uncertain budget time next session?
Yeah. So fully concur with the Comptroller that there is uncertainty in Washington right now, and it will have a big impact on state budgets dependent on what the Congress decides to do. I'll say first, we will be fully supportive of the work to make sure that Congress preserves its responsibility to the Medicaid program, mainly what was set out in the Affordable Care Act, and we'll be working with our congressional delegation, which is fully supportive of that program, working with our state legislators and leaders to make sure that the federal commitment to Medicaid remains. But we understand we don't control all the cards, and we're going to have to adjust as those dynamics shift. I think what we can do, though, is prepare for what we need in the future.
Sure.
And look at what is the vision that we want the Medicaid program to have into the next 5 to 10 years. And for us, we think it's certainly about improving provider rates, but also about using Medicaid as a force to help improve community health.
Right.
And that hopefully will produce savings down the line so that as people remain healthy, they're not needing as much sort of direct health care as they need today.
Right.
So I think we have an opportunity certainly discuss financing. We need to do that, but also to talk about the vision of what the program looks like.
And something else here I know you've been pushing for, we've seen a hospital merger and acquisition process with the financial pressure and lack of money right now. Many of these hospitals likely won't bounce back. So for many, I think they sort of see these deals, talk of takeovers, and they just think, well, it'll be another name on the outside of the building. Well, we've talked about this before. There are some differences. There are things hospitals are saying they need in this process. I know CHA has talked about proposes to changing that process, patient protections. Where does that sort of stand right now as we head into next session? Are there any changes you want to see brought up there?
Yeah, we continue to think that that process is called CON.
Yep.
That process could be much more efficient.
Okay.
We see it in our neighboring states. We see it in New York. We see it in Massachusetts. We want to preserve care in every community in the state. And as you noted, sometimes that's going to require some shifting within our state around the hospital system or the hospital itself. That process to do that through the state can't take 2 years to complete. That uncertainty is threatening patient access to care. We could do it much more efficiently, and that's what we're going to be advocating for at the legislature this year.
And heading into next session as well, we talked about Medicare, we talked about CON changes that you're pushing for. Last year was a short session, so we did see a lot of things, die on the floor. We talked about workforce needs. So what are some of the other elements in our last 2 minutes here that you really want lawmakers to focus on? Any proposals that you're either introducing new or things that maybe died last year that you want to see reintroduced or reprioritized this session?
The one thing that we're going to be advocating in favor, and we think it's really a patient protection, which is unfortunately, every probably Connecticut resident has experienced needing to work with their insurance company to get prior authorization for a service they need, that their doctor says they need, and or they get the service and the insurance company tells them after the fact that you didn't really need that service. We think there are some common sense solutions there that we hope would work for the insurance industry, certainly would work for hospitals, but most importantly would work for patients, to make sure people understand what is the process, what's required, what is not, and that happens quickly, and that the medical judgment of caregivers is first in line when those decisions are made. So we're going to be advocating for that pretty aggressively. We think, again, common sense solutions that help patients navigate what is an overly complicated system.
Yeah, well, definitely a lot to pay attention to this session. As always, Paul, thank you so much for taking the time. I'm sure we'll be checking in next month once everyone's back up at the state capitol.
Always appreciate the opportunity.
Of course, thank you. That does it for us here now on The Real Story, but of course we have a lot more coverage online on our app and on air ahead of presidential inauguration and a quickly approaching state budget session. So be sure to check that out. And as always, you can catch The Real Story every Sunday at 10 a.m. or streaming on Fox 61+. Have a great morning.